Hi, this is Brian Kim. I'm going to share with you this case of a SimulEYE iris suturing / IOL fixation model, and I'm going to use my 5-point iris hook placement and removal technique. I was at a resident teaching course, a wet lab, and I was assigned to instruct iris placement and removal, and I felt like I didn't have a video on my channel to show this technique, and so after teaching that course, I figured I'm going to go ahead and use a SimulEYE model to be able to explain in more detail exactly how I do this pentagon shape iris hook placement. I place one in the sub-incisional area, and this helps retract that. This allows me to track the iris over the main incision, which does a great job in retracting the iris so that I don't get any iris herniating from the wound and I don't grab the iris and cause damage to the tissue. And so I'm going to show you how I'm able to place the iris hook efficiently and also remove the iris hook efficiently without damaging the iris hook. And remember this, the SimulEYE model is an excellent model, but it doesn't really quite duplicate human tissue. When you try to twirl the iris hook, it tends to have more friction. And so just bear that in mind with these cases. And so here is the iris suturing / IOL fixation model, which I'll be using for the iris hook practice here. You can see this is what it looks like. It's deflated when it comes out of the box, but we'll go ahead and inflate it in just a moment here. It comes in a pack of 2 here. And now I'm going to go ahead and mark the tip of this cannula, and I like to mark the tip of the cannula as a guide for where I'm going to place the incisions. So go ahead and now also mark the tip of my paracentesis blade, and I want to go in fairly perpendicular, and you'll see when I make the incision in a human patient, I want to put the iris hooks in before I place my viscoelastic. And that's because if you fill the eye with viscoelastic, it pushes the iris diaphragm away from your corneal incisions, and it makes it actually harder to place the hook around the iris because you have to dive down a little bit. It's a little bit more challenging. But you don't really have to fill the eye with viscoelastic when you make your incisions at the very beginning because the eye is still filled with aqueous and it hasn't really collapsed. In fact, if it collapses just a little bit, it still is actually advantageous because it brings the iris diaphragm up a little bit more to hook a little bit more easily. So this is some viscoelastic. I'm going to fill the eye now with it, pushing the bubble out, and now you can see how the cornea is more shaped and more formed. And I'm going to make my sub-incisional incision with the parablade here. Again, staying fairly perpendicular to the iris plane. And so these are the iris retractors, came with the kit here. You can see the hook is on one end and the stopper is on the other end. And really the trick is knowing how to manipulate the stopper and also manipulating the hook itself. I always like to hold the iris hook perpendicular with the forceps. And you'll want to hold it perpendicular because it gives you the most control. See what I'm doing here, I'm holding it obliquely and I'm trying to show how it's a little bit more of a challenge. And when you're trying to push it in, it doesn't really work as well. You see as I turn it, you want to hold it at a right angle. And it makes it a little bit more easy to place the incision. So I was showing there that I was holding it too far away. And then I'm going to try to hold it a little bit closer. Again, this is not like human tissue, so there's more resistance, more friction. So bear that in mind. And human tissue is actually much more easy to place it in. You can see I'm just twirling the stopper. And as I twirl the stopper, you can see the direction of the hook is twirling as well. And so that's the first concept, using the stopper to direct the orientation of the hook. So you can see right there, I turned the stopper, I was able to grab the hook distal to the stopper, lift it, which turns the hook down, and then it engaged the pupillary edge here. And so look, see, I'm trying to illustrate when holding the hook with the left forceps and you're trying to twirl with the right side, you can't do that. You have to have a gentle hold with the left forceps, and then when you're holding it and guiding it, now you can twirl as you see here. So you can't hold it firmly, of course, because then otherwise it won't twirl. You can see as you twirl the hook downward, you can grab the distal end towards the stopper, lift it up, and then the hook points down and then engages the pupillary edge. So this is the second hook. Again, you want to hold it again at a right angle. You see here, if you hold it too far away, again, it's a little bit more of a challenge. You see it's kind of bending. So holding it too far away makes it more difficult to control. And so that's what I'm showing here. And again, holding it obliquely, not really the best technique. But if you hold it a little bit closer and you hold it at a right angle, as I'm trying to show here, it's a little bit more easy to push it in. Again, like I said, there's a little bit of friction with these models. So I'm holding it a little bit closer, and you can see now it's starting to go in and it pops through. I want to make sure that the stopper is pushed all the way back like it is. Again, you can twirl the stopper. This is rather stiff in the SimulEYE model, not quite like the human eye, so just bear that in mind. Pushing the stopper down, and by pushing it down, it does give you a little bit more control as you twirl it. You can see here, now I'm doing a two-handed twirl. That's what I'm trying to illustrate here, a two-handed twirl. Now the hook is pointed down. And you can see, again, you can grasp with the right hand here gently to control it, and then twirl it with the left hand, and then flipping and reversing and doing it with the other hand, grasping and controlling the hook with the left hand and then twirling with the right hand. Again, I'm just showing you, you can flip hands and still twirl it either way, but you're not holding it firmly because otherwise it won't twirl. You're just gently holding it just as a platform so that you can rotate it. Once it's pointed down, you lift, and then it makes the hook itself tilt downward, and then you engage the edge, and then you pull it. Remember, once you engage the pupillary edge, it's like a fish hook. Once you engage it, you have to tent it up and hold that pulling force while you cinch down the stopper. If you let go, then it'll disengage on the pupil. So that's a very important concept. So right here with this third hook, I'm just making sure that I have a good incision, trying to locate where the incision is. And it was rather tight there, so I'm going to make another incision. And so I'm holding it again at a right angle. It slides right in. Make sure you push it so it clears the pupillary edge, the hook. And then again on the stopper side, I'm pushing it against the limbus there, making sure it's a little bit tight. And again, you can move the stopper up and down as I'm showing here. But again, you're making sure the working end, which is inside the eye, again, the hook is more central to the pupillary edge. Again, various ways of twirling the stopper so that the hook is pointed down again, like I was showing before. Once it's pointed down, you lift, and as you lift, the working end, the hook part, dives down, it engages the pupillary edge. And remember, you have to hold the wire up as it engages the hook, and you want to think of it like a fishing hook in a fish's mouth. Once you engage it, you can't relax it, otherwise it could slip off the pupillary edge. Here I'm showing a different technique. If you're having trouble bringing the working end, the hook around the pupillary edge, you can rotate it sideways like I showed you there. You can actually sweep the device such that the working end sweeps around and gets underneath the pupillary edge. So again, if you have trouble grabbing it, you're getting frustrated, and you're feeling like you're not able to reach it, twirl, lift, and then engage. So that's what I was trying to show there. Again, you're missing it, you're missing it. And that's because you have to pull up so that the working end, the hook part, is actually goes and dives down so that it engages a pupil. Again, here, this is that oblique technique, twirling it, turning it sideways. You can see it's going sideways, and I'm turning it towards the area that's already hooked. Because remember, that second hook over there is tenting up the iris. So if you direct this third hook towards that area, the iris is already lifted, and so you can use that to your advantage. So that's another pearl, is try to direct the hook towards the already engaged hook against the pupil here. So this is the fourth hook now. Again, I'm showing how I'm holding it too far back. And obviously it's bending, it's not going in. Again, you want to hold it at a right angle. It's more easy to control, and you have more of a platform for it to have more control there. So I use my forceps to see if I can find the incision there. Again, this one's a little bit tight. I'm using a two-handed technique to slide it in. So I'm able to advance it. And again, you can twirl. You can see how I'm just using the forceps just to twirl it. And now I decide to put the surface coating gel. The surface coating gel does provide great visibility in case there's some imperfections on the surface of the cornea. It can cause glare, etc. And so you can see how I'm going to use the surface coating gel to help visualization. And it's got quite a bit of surface tension, so it stays on the cornea and it's bubbled up, as you can see here, but it's not running all over the place, which is rather nice. So again, I'm cinching down the stopper. I'm able to twirl it here. So you have really good control of the direction of the hook. So again, I'm trying to see if I can engage it, twirl it so it's pointing down. Again, illustrating how to twirl by pushing on the stopper. And really, if you master this concept of twirling the stopper to direct the hook, it's really quite easy. And you can see here now, I very subtly directed the working end of the hook towards that third hook there. You see that? So I'm going to turn it towards that third hook. I'm going to try to twirl the hook down. You see that? I'm turning it sideways towards that third hook. It's already lifted up. So you're able to direct it. You don't have to point it down so much when you do it that way. See, I'm tilting it the other way. Not so easy because that fifth hook is not in place yet and the iris is not tented up. But I was still able to engage it, but really much easier to engage along where that third hook is. So again, once you engage it, you want to hold it and then slide the stopper down. So again, manipulating the tail of the hook so that you can direct the working end, the actual hook itself. You want to direct it towards where the iris is already tented up by the previous hook. And of course, since it's tented up, it's easier access to do that. Here, the last hook is going in, but as you can imagine, the SimulEYE sclera is rather rigid and tight. So I had to get creative in pushing that hook in. Obviously, in a human eye with the sclera, you're not going to be fighting the sclera at all. That's not the hard part. you'll be fighting the conj. So with the fifth hook, which is sub-incisional to your main incision, you have to be mindful of conj. So when you make your stab incision, if you get a bunch of hemorrhage, it could be difficult to visualize what you're doing. But as long as you know how to do the technique and clear the conj out, you'll be able to have a nice view straight to the sclera and place the hook in really beautifully. And it does a great job retracting that sub-incisional iris. It's not getting in the way when you're placing your phaco handpiece or your INE handpiece through the main incision. So for this final hook, you can imagine the sclera, again, is so much resistance, it's going to be more difficult to twirl the hook. But with patience, you can see I'm using a one-handed technique and I'm twirling the actual device, almost like turning a wrench. I'm using the forceps to turn it down because the twirling with the stopper is just not enough. It's just too much friction. It's not turning it. So once I turned it down, I was able to lift the tail and it causes the hook to go down. It engages the iris. So again, now I have 5 hooks. This is exactly how I do it when I do my small pupil cases. I have excellent visibility, but I also have excellent control of the iris. There's no sub-incisional iris in my way. Sometimes if you don't have that sub-incisional, you actually have a big chunk of iris kind of getting in the way of your incision. And when you're doing various maneuvers, in particular when putting the lens in, the iris might prolapse out. And so it's really not the best way to do it. So you can see here, I'm going to take the hooks out. You just disengage, pull the stopper back, pull the device inward so it disengages the edge of the pupil, twirl it so that the hook is not pointed down anymore, and you're able to pull it out. But this is the key. As you saw here, you want to turn it at a right angle, and you rotate the device so that the open end of the hook is being rotated out. So let me show you that again, the second one. Again, you pull the stopper back. And then you want to pull the device in a little bit, twirl, so that the hook is disengaged from the pupillary edge. As I pull it, the free end, you see the free end of the hook, I'm going to pull the device at a right angle towards the free end. So on this side here, the free end is pointing to the right, therefore I rotated the device at a right angle to the right, and then it just allows that free end to just pop out. By doing it that way, you won't damage the hook itself, because remember, iris hooks are reusable. That's the difference between rings. Rings are not reusable, iris hooks are. And so if you do this technique where you carefully pull it out, and again, you see the free end, and this one is again pointed to the right, and therefore I rotate the device to the right. It rotates it such that the free end now can just slide and rotate out of the incision. Of course, this is a SimulEYE model eye. The tissue is a lot more stiff, so it really doesn't take that much effort when you're doing it in a real eye. And so by doing it this way, you get to preserve the integrity of the iris hook. You'll be able to use it multiple times. Again, iris hooks are fantastic, very versatile, not only for just a routine small pupil, but when you're trying to retract for complex cases like dislocated lenses and cases where you have zonular dehiscence and you want to put in Gore-Tex suture or Prolene suturing or CTR, CTS segments, you want to do Yamane technique. Any of these situations, it works so well having iris. You can strategically place those hooks any way you want to, not just in a pentagon shape like this, but if there's a focal area you want to retract more, let's say you have an iridodialysis, you want to retract more, you can do all those nice maneuvers because you can strategically place those hooks wherever you want. So again, this is my technique on how I use the SimulEYE model eye to illustrate my iris hook placement and removal technique. Again, using 2 hands, holding it at right angles, making sure you can twirl the stopper and the technique of twirling the stopper, using the other hand kind of as a platform as you try to twirl the stopper against that forceps. you want to grab the tail of the device, lifting it up so that the hook, the working part, dives down and then engages the pupil. You want to lift up and hold tension so it actually causes tension on the pupillar edge, slide the stopper down, and then you're done. Sometimes if the edge of the pupil is too deep, too posterior, you can do like I showed you as you dive down, or you can turn it sideways and direct the hook towards the previous iris hook that's already been placed. Again, that one is already tinting up the iris, so you can take advantage of that and sweep it in that direction, and it's more easy to engage the iris pupillar edge in that area. And then, of course, placing the sub-incisional, of course, with that, you have to be mindful of hemorrhage and the conjunctiva. But as long as you make a nice incision, you're able to find, using a cotton tip, in my case, I usually use a cotton tip, to find where that incision is and slide it quite nicely. And then again, when you're removing it, it's quite simple. You want to pull the stopper back. You want to push the iris hook in more, twirl it so that the hook disengages from the pupillar edge. Pull it out, but as you pull it out, look at the direction of the hook. So again, if the free end is pointed towards the right side, then you twirl the actual tail of the device at right angles towards the right. It causes the hook part to rotate, and then it slides right out. So again, this is an atraumatic way without damaging the iris hook, removing it so that you can reuse it in successive cases. And I hope that this technique shows you how easy and versatile iris hook placement is. Don't be intimidated when it comes to iris hooks. Don't necessarily feel like you have to use a ring in all of your small pupil cases. Iris hooks are actually quite easy and efficient to do, and quite economical because you can reuse the iris hooks. So I hope this was helpful to you, and I thank you for your attention.